I do feel uncomfortable and my sore throat. It's not going away. So that's mostly where the pain is. And I do feel achy, but I wouldn't say it's too bad. It's just mostly my throat.
So you would say that you feel the most pain in your throat now?
Mm-hmm. Okay. And I have this, I feel like sometimes I like cough. I just want to I don't know, it's a whole thing.
Okay, so just backed up.
Yeah.
Okay. So I'm going to go ahead and start by just doing a visual inspection of your body. I'm going to check for any redness, any rashes, any irritation, dermatitis. Sometimes viral infections specifically can manifest themselves through the skin as well. So I'm going to go ahead and just inspect you. Just take a look. Going to look at the scalp in the front and the sides. Sometimes we can have redness, irritation that starts at the scalp area since it's very sensitive. So I'm not seeing anything out of the norm, and your chest is not red, not reddish, not seeing any colors that pop out. I'm going to look inside your arm as well, since sometimes we can have psoriasis, dermatitis hiding in the inner portion of the arm. Okay, and over here. Palms are not red. Checking the capillary refills. 2 seconds. So circulation is normal. Okay, that looks good. And let me see the inside of your palm as well. Checking the circulation in your right hand. Within 2 seconds, good. Okay, and okay, so I'm not noting any abnormalities with your skin. I'm gonna go ahead and palpate your head and your lymph nodes and your arms and just make sure I don't feel any bumps, any lumps, any congestions, especially with your sinuses. So let me know if you feel any pain. Okay, I'm gonna start my way from the top with your head. And you can just close your eyes and relax. And any soreness, let me know. Okay. So your head is symmetric. Checking for lumps and bumps now. Okay, not feeling any. I'm going to check your mastoid bone process behind your ear. Any pain there? I'm going to check your lymph nodes. Okay. Preauricular and cervical occipital lymph nodes are barely palpable and mobile. Same with the supraclavicular lymph nodes. Okay. Checking your sinuses. Any pain there? All right. And the pectoral and auxiliary lymph nodes. Sometimes when we have viral infections, the lymph nodes are the first ones to react. I'm not feeling anything out of the ordinary. Good. All right, so I'm gonna go ahead and take your temperature and listen to your heart and your lungs. Check for any wheezing, any bronchitis signs, pneumonia signs. Okay, so let me take my basket here and let's start with just your temperature. 98.7. So right now you do not have a fever. When was the last time that you mentioned you noticed you have a fever?
Yesterday.
Okay, so yesterday. And right now, 98.7. So we are good for right now. Let's check your oxygenation as well. Please have your index finger. Okay, you can set this aside. And I'll just feel your pulse over on this other side while that reading takes place. So oxygenation is 99.8, so that's good. The heart rate is a little bit on the lower side, 70 beats per minute, and respirations were okay, about 15 respirations per minute. Are you an athlete by any chance?
I haven't really been in a while.
Okay.
Like in high school I was, but now I mainly do my walking and biking, but nothing more strenuous than that.
Okay, so let's check your blood pressure then. Since your heart rate was a little bit on the low side and you don't work out too intensely, so that can't explain it. All right. Have you been dizzy at all today?
Twice earlier when I got up really fast. Yeah, that happens usually when I get up.
But you haven't fainted or anything?
No, but I did have to like hold on to the chair to make sure I had balance. I did feel a little out of it, and my vision was blurry during that, but it didn't last long.
Okay. Can you do me a favor and hold that for me? And just lift your arm like that. So let's see if we're dealing with just a normal blood pressure or maybe a hypotension here. Given the low heart rate. So just go ahead and breathe normally. So a little bit on the low side. Okay. So try to open and close your fist like this one a couple of times to recirculate the blood, and lift your arm above your head. Okay, good. And do that 10 times. Okay. Good. And now let's take another reading. There we go. 4, 5, 6, 10. Now, a little bit on the lower side. And I'm gonna make a note of that. Are you feeling dizzy right now by any chance?
Not too much, since I've been sitting down for a bit. But I feel as soon as I get up and I'm a little mobile, I might feel that again.
Okay, so 90 systolic, 60 dystolic. Okay, are you drinking enough water?
I guess I could be drinking more.
Yeah, definitely try to get in at least 6 to 8 glasses of water per day, so you keep your body hydrated, and that's going to carry water into your blood and keep circulation going and hydrate you. Okay, I'm going to set this aside, and I'm going to do an eye inspection. Can you look into the distance for me? Good, so pupils are round and reactive to light. Can you look up for me? I'm going to take a look at your conjunctiva. Okay. Pink and moist. Can you look down? Okay. Good, and now can you look at my nose? I'm going to check the consensual response. Direct, consensual, direct. Good, perfect. Okay, and next up I'm going to take a look at your ears, and then your nose and your mouth. Okay. Alright, let's just inspect them. Can you look towards your left? Good. Have you noticed any discharge, anything abnormal with your ears?
No.
Okay. Alright. Good, so ear oracles look healthy to me. I'm not seeing any external discharge. I'm going to take a look inside your ear canal with my otoscope here. Okay. And you mentioned a little bit of stuffiness and pressure. Is
Mostly this ear.
mostly that ear. Okay. So let me go ahead and look inside this one first. If you can look over to your left. Okay. A little bit of wax build up in the normal amount. Tympanic membrane looks healthy, well-defined margins, pearly gray color. Bony landmarks are present. The light cone is present. Okay, so not seeing any signs of any infection here. Let's take a look here. Okay, does this hurt?
No.
How about when I pull up?
No.
Laterally?
No.
Okay, let me take a look inside. Just gonna come close. Okay, a little bit of a redness, slight beginning of what could look like an infection. Yes. Okay. Any pain in this ear right now?
No, not too much. It just feels a little blocked, a little, I don't know how to describe it. Just a little uncomfortable, but nothing crazy.
Yeah, tympanic membrane looks okay, well-defined margins, expected color, but I'm seeing a little bit of a redness and what looks like the beginning of an ear infection. So we'll put you on some antibiotics to deal with it.
All right, thank you.
Okay, so I'm going to make a note of that. Left ear, inflammation noted, redness and slight yellowish discharge. Okay, so I'm going to prescribe you an antibiotics. We'll put you on some amoxicillin, which is a broad spectrum antibiotic, and that should clear it right up.
Thank you.
Okay, so next up I'd like to take some measurements, and I'm looking for any asymmetry, any inflammation I may have missed just by visually inspecting you. Okay, so I'm going to begin by measuring the crown of your head. So we are at 22. Okay. Across the shoulders at 9. Okay, over your arms. Okay, 6. Just going to take a note of that. Okay. I'm going to check your reflexes next, and that's just going to provide me with just a general view of your neurological state. So I'll be tapping you with my medical hammer and let me know if you feel any pain or discomfort. Okay, I'm going to start with your jaws. If you can just open your mouth a little slightly. That's too much, a little lower. Perfect. Okay. Good. All right. Good. Good. And just relax your arm. Good. Perfect. Okay. Any pain here?
No.
Good. And all right, so reflexes check out. No major neurological red flag. Right, let's take a look at your nose. So you mentioned that you did not have a runny nose, or have you had a runny nose?
I did have it earlier in the week.
Earlier in the week, but not right now. Okay, can you look up for me? I'm just going to check for any obstruction. Okay, not seeing anything, so I'm just going to palpate your nose and your sinuses inside here, ethmoid and sphenoid sinuses. Just close your eyes. Okay. Any pain here? All right. And let's take a look inside your mouth. Okay. You can stick out your tongue for me And open up and say, ah. Yeah. Definitely an inflammation in the back of your throat there. Can you lift up your tongue? Touch the roof of your mouth. Okay. Okay. Yeah, so I'm definitely seeing a very red sore throat. Sore throat. And I'm also seeing a couple of little pockets of whiteness, so that is indicative of strep. Early stage, there are not too many of them, but definitely something is brewing over there. So the amoxicillin that I gave you for the ear should help clear the throat as well. Okay. Wonderful. Definitely make sure to take the full course of antibiotics. I'm going to prescribe you a full 7-day course.
Okay.
Even if you start feeling better, do finish all of them.
Thank you.
All of the doses.
Good.
All right. Next up, I'm going to listen to your heart and lungs. So you can just close your eyes and then relax. Heart sounds healthy, no murmurs. Go ahead and take a deep breath in and out. Okay, deep breath in and out. Deep breath in and out. Okay, good. Now breathe normally. Okay, I'm also going to listen to the pace of your lungs right here. Yeah. Hearing a little bit of wheezing, Alessandra. A little bit of wheezing in your lungs. Definitely, based on the symptoms, you are fighting some infection. Okay. Not too bad though. Alright, next up I'm going to just test your dermatomes on your chest and on your face to just rule out any other neurological disorders. So we're going to go ahead and do a test that's called sharp or dull. Maybe some have your palm. Okay, so this is dull and this is sharp. Feel the difference? Yes. Okay, close your eyes and tell me if you feel sharp or dull. You can lower your hand. Okay.
Sure. Dull. Sharp.
Alright.
Dull. Sharp. Dull.
Alright. Now I want you to tell me when you stop feeling the dullness. So just say now. Good. And do you feel this?
Yes.
Equally on both sides of your forehead. B1 is clear. Do you feel that? Equally on both sides.
Yes.
B2 is clear. And do you feel that?
Yes.
Equally on both sides.
Yes.
Good. V3 is clear. And do you feel that?
Yes. Yes.
That.
Yes. Yes. Yes.
Good. Alright, let's go ahead and lie down so I can take a look at your abdomen.
Okay.
Alright, Alessandra, are you nice and comfy? Alright. So I can go ahead and just relax. I'm going to focus on your abdominal area. And is it okay if I lower your jeans a little bit? Okay, can I unbutton them?
Yes.
Okay. Alright. Oh, how long have you had the belly button ring for?
For about 9 years.
Okay. So it looks like it's in wonderful condition. No signs of any infection or inflammation. Alright, I'm gonna go ahead and just inspect your abdomen first. I'm going to listen to your tummy and check for abdominal cavity activity. Have you had any breakfast this morning? Okay. I'm definitely hearing activity, equally distributed within the 4 quadrants of the abdominal cavity. So that's good. The sounds are clear sounds, no signs of any obstructions. Okay. So that's all quite normal. I'm gonna set my stethoscope right here. Okay, now I'm gonna go ahead and first do tapping and check the resonance of the sounds that come from your abdominal area. Okay. Checking for dullness and uniformity all throughout. Okay, good. Good level of resonance. Perfect. So I do like those sounds. Right, next up I'm going to go ahead and palpate and feel for any lumps, any bumps, any masses that shouldn't be there. Focusing on your liver first. And the tip of the liver is barely palpable, but I do feel it. And liver is not enlarged. Okay. Right ovary, left ovary, no pain. Stomach is not enlarged. Spleen the same. Kidneys are okay too. Okay. I'll go ahead and just measure your abdomen here. So, checking for symmetry again. That looks good. 30 across. Good. I'm looking for any asymmetry of your, now the proportion of your torso relative to the measurements that we took of your head. Good. 9.5. Any pain when I press down on your belly button? Okay. All right. So I'm going to close you up here and let's take a look at your knees and your feet and your legs. Okay, so I'm going to check out your knees. And I'm going to just palpate first and check the patella, the tibia bone, and the cartilage. I'm not feeling any signs of inflammation, no masses hidden. Cartilage is mobile. Alright, I'm gonna do a little tapping on your knees, check for any abnormal pain. Okay. I'm also going to take a couple of measurements, check for symmetry. And can you lift your leg a little bit? Cross is, okay, we are at 35. Okay, and now lift this one up a little bit. 34. Okay, I can lower them now. Alright. So knees look good. Is it okay if I remove your socks?
Mm-hmm.
Gonna set that one down. Okay. I'm going to do a visual inspection of your leg and your feet. Put my glasses on for this. Okay. Not seeing any redness, no obvious signs of any inflammation. I'm going to check the pedal pulse first. 2+, synchronized. Okay. Good. Pedal pulses are okay. Taking a look at your nails and in between the toes. Can you curl your toes around my fingers? Perfect. And now wiggle your toes for me. Good. Okay, checking the capillary refills. Good. 2+ on all of your toes, so good circulation. Toes are a little bit cold, but even temperature all throughout. Okay. I'm going to attempt to spread your legs apart. Don't let me do that. Good. Now I'm going to attempt to bring them together. Don't let me do that. Perfect. And now push into my palm with your toes. Good. Right, flip over so I can take a look at the plantar region of your legs. Feet. And can you wiggle your toes from this position? Good. No obvious calluses, no redness. A little bit of skin peeling, but that's normal given that it's winter and so dry outside. Okay. I'm going to palpate the plantar region of your feet. Starting with the calcaneus region. So no tenderness, no pain is noted. I'm not feeling any deformities. The arc of the foot looks good. Okay, do you feel this? Mm-hmm. And this? Mm-hmm. Which one was sharp? Left or right?
Left.
Okay. Is this sharp or dull? Okay, again?
Dull.
Okay.
Dull. Sharp. Sharp. Dull. 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 Sharp.
Okay. And is this hot or cold?
Cold.
Okay. Do you feel this?
Yes.
And this?
Yes.
And this?
Yes.
And this?
Yes.
Okay, I want you to tell me when you start feeling this sensation.
No.
Okay.
No.
Good.
No. 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 No.
Excellent. And do you feel this?
Yes.
And this?
Yes.
Good. Okay. Any pain there?
No.
Any pain there?
No.
All right. Let's take a look at your back next. Right, Alessandra, is it okay if I remove your hair? And I'll just tuck it to the side. Actually, I'll just tie it in a ponytail. So I have a hair tie right here. And is it okay if I unhook your top to expose your spine? Okay. Just tuck those right there. Well, inside. Alright. So I'm just going to feel the temperature of your back first. Evenly distributed. Going to check your spine. Can you bend your head forward a little bit? Yes. Okay. Feeling a little bit of a deviation right here. Okay, can come to the center. Just a slight deviation in the curvature of the spine here. Okay. Thoracic and lumbar spine is straight. And now I'm checking for any nodules. in between the vertebrae. Okay, head down one more time. Okay. And you can come back to the center. Okay. Good. $39, $40. Just checking the ratios. 40 over 37. Good. Okay. I'm also going to listen to your back, to your lungs. Take a deep breath in and out. Deep breath in and out. Okay, now we're going to do something called whispered pectoraloquy. So go ahead and whisper 1, 2, 3 whenever I touch you with my stethoscope.
1, 2, 3.
Okay. One more time.
1, 2, 3.
Good.
1, 2, 3.
Good.
1, 2, 3.
Good. So I'm barely able to hear you through the stethoscope, so the resonance is just as expected. All right. Now I'm going to check the sensitivity on the dermatomes right around your spine area. So I'm going to touch it with a slightly cold object, and I'm just checking for any abnormal reactions. Okay, good. And do you feel this?
Mm-hmm.
And this?
Mm-hmm.
Okay. So back exam checks out. No positive findings. I'm going to go ahead and close your top and we can discuss the results. Okay, Alessandra, this concludes the exam. I did a neurological assessment, a cardiovascular assessment, full body examination. I could find a little bit of an infection starting in your ear and what looks like strep in the back of your throat. And I have here a prescription for you for amoxicillin. So take that once every 12 hours, one dosage, 10 mLs for 7 days. Other than that, let's monitor how you're feeling, and I'd like to see you back in a week or so and reassess you.
Thank you.